Anchor ED program, which is associated with the Providence Center and Anchor Recovery Community Center. I am responsible for overseeing 22 recovery coaches at the present time, going into local hospitals throughout Rhode Island. As of Friday, we'll be in all local hospitals in all of Rhode Island, which is incredible. We started out with only 2. But for the real reason I'm here is I'm here to talk about my project, which is called Vigilant Recovery. Vigilant Recovery is about helping men and women coming out of prisons or treatment centers, detoxes, et cetera, who have children that are involved with DCYF care. As we know, when men or women come out and they interact with DCYF asks for a lot of conditions to get their visitation rights back, to get the children back into their lives, and all that. Things like going through counseling, clean detox, clean urine screens for a while, education, job, housing, appropriate housing with own bedrooms for the kids, and et cetera. And a lot of times what happens is, what I've seen over the last several years working in the field of addiction, is that these men and women come out and they get discouraged, okay, and they feel all this pressure, and what happens is they go back, they turn to what they feel comfort with, and that's using and abusing substances, and as a result they end up going back to incarceration, go back to treatment, whatever it may be. So Vigilant Recovery started out about 2 years ago. 2 years I've been working on it now, and it's been a slow go. I work in the field of addiction, and I work for the Providence Center, and I've been trying to figure out how to incorporate my job with Vigilant Recovery, and I'm putting together a proposal that I want to present to Providence Center, and ask them to back me. And as a result of doing that, it took a lot of time, it took a lot of research, and which brings us to this term that I took, Sustainable Impact, which is basically about gathering research and data and all that. And I learned a lot. I learned a lot about my project. I learned a lot about the research. I learned a lot of numbers that I'm in the middle of right now, trying to put together and break down and put it on paper. So when I do get ready to present my project to the right people, I know what I'm talking about. I know exactly what I'm talking about. I'm having, all my T's crossed, all my I's dotted. I also took this term, statistics, mathematics course, and I'm not good with mathematics. I'm good with dollars and cents. Anybody out from the streets is good with dollars, right? But come to mathematics and statistics and all that stuff, I looked at it and it looked Chinese to me. So over the last 8 weeks, I really learned and I grew an appreciation for numbers and charts, and how all this is gathered and broken down, and formulas and all that. And I still don't like it, but I understand it a lot better today. And I have an appreciation for the people that do work with the numbers on a daily basis. And Providence Center, fortunately, I have an IT people where I can just get all the information, give it to them, and they break all of it down, and they put it into the graphs of the positives and negatives and the pluses and negatives. I had worked on several things through the Big Ten. One was a lot of critical thinking. Which allowed me to identify and consider the influence of the bias in other assumptions. Specifically meaning that what I'm trying to do is I'm trying to find the purpose of why my project, Vigilant Recovery, is sustainable, not only for today and tomorrow, but for the future. Okay? What's the purpose of Vigilant Recovery? The purpose of Vigilant Recovery is to provide resources to the clients that we serve of easy access to housing, job education, job training, education through College Unbound, GED courses if they need be, peer-to-peer support specialists as myself, and another aspect of this, as we're learning that peer-to-peers are becoming a profession in the state of Rhode Island, and it's growing throughout the country. And myself, I've just became a trainer to train other recovery coaches, to train people to become recovery coaches. So I'm actually learning from the opposite side of the field, training people how to be a recovery coach, I guess you would say. Accountability was a big 10 that I used. And why do I say accountability is because I became accountable for all that I want Vigilant Recovery to be to accomplish. And what that means is that I'm trying to build a relationship with DCYF, which is the Department of Children, Youth and Families, so that they trust Vigilant Recovery to come to Vigilant Recovery and use us as a resource. Okay? And in building that relationship, you have to be honest with them, and you have to be accountable for all the decisions that we make, from something small to something big. And what do I mean by that? So the question was proposed to me, well, what happens if I have a client come in and failed a couple of drug tests, and then the DCYF caseworker asked you about the client? Well, I'm going to have a contract with the client. Vigilant Recovery will have a contract with the client that'll state if they did fail these urinalysis tests, that we are liable to inform DCYF. We're not doing this basically to hurt our client, but we're doing it because our goal is to help you regain custody, regain humanization, I guess you want to say, to become a person again. And in order to do that, we have to be accountable for all the services that we provide. Collaboration. Collaboration is another big one that I've been using, and why I say that is because of, I'm working through a Providence Center. I want Providence Center to fund me. I want Providence Center to guide me. They have the expertise. They're the largest mental health addiction organization in the state of Rhode Island. They're partners with Care New England, another large corporation. By myself, I'm just a small guy. But with a big umbrella, big things can happen. And what I'm looking for is something at the end where